friends, this is Soham Bera. Today I am going to tell you about the relationship between aging and with our eye. So let's start with it. Of your 5 senses, which one are you most afraid of losing? If you are like most people, the answer is your ability to see. Despite this, many people are not conscientious about caring for their eyes and often neglect to visit an eye specialist for routine eye examination as they get older. This video focuses on 4 disorders that poses the greatest threat to vision after age 40: cataract, glaucoma, age-related macular degenerations, and diabetic retinopathy. It will help you determine your risk of developing this disorder, describe the symptoms and disease causes, diagnosis and treatment. This report also describes flashes, retinal detachment, and eyelid problems such as dropping of upper or lower eyelid. You will also learn why you should have regular eye examination, especially if you have diabetes or a family history of glaucoma, how to recognize the risk factor and symptoms of specific eye diseases, and what steps you can take to prevent or treat them before your vision deterioration further. First, I am going to tell you that this is a very important: get a comprehensive dilated eye examination. Everyone age 40 or older should visit an eye care professional for a comprehensive dilated eye examination. Many eye diseases have no early warning signs or symptoms, but a dilated examination can detect eye disease in their early stage. Before vision loss occurs, early detection and treatment can help you save your sight. Even if you are not expecting any vision problem, visit your eye care professional for a dilated eye exam. He or she will tell you how often you need to have one depending on your specific risk factor. Cataract. The term cataract usually referred to age-related cataracts. A cataract is a clouding of the lens, a transparent layer structure that lies behind the iris. A cataract may begin to form as early as age 40 or 50 and at first goes unnoticed by the time a person reaches the age of 60. The cataracts may have become advanced enough to cause low vision. In most people with cataract, surgical treatment and restore adequate vision. Second, age-related macular degenerations. Age-related macular degenerations, or AMD, destroy the macula, a cluster, a light-sensitive cell in the central part of the retina. The structure at the back of the eye. The macula is responsible for crisp central vision and perception of fine details. More than 15 million people have AMD, and its leading cause of low vision in those aged 60 and over. In fact, 20 to 30% of age 75 and older have dry or wet age-related macular degeneration. And age is the most important non-modifiable risk factor of this disease. Early diagnosis and close follow-up are essential to preventing or to preserve your vision in people with age-related macular degeneration. Glaucoma is a group of related diseases in which the optic nerve becomes damaged by excessive fluid pressure within the eyeball. In a person like open-angle glaucoma, by far the most common type, fluid drainage fails to keep pace with output. Pressure builds on the optic nerve as the fluid level rises. This process takes place so gradually that it may be imperceptible until irreversible. Vision loss has occurred. Eventually, the optic nerve becomes so damaged that it's unable to transmit or compiling signals to the brain. Adults over the age of 60 are at increased risk of developing glaucoma, and elderly adults over the age 83 or 10 times the risk to develop glaucoma. And those in their 40s also have chances to be a glaucoma patient. Fifth, diabetic retinopathy. The eyes is supplied with its own microcirculation, tiny blood vessels that nourish the retina and other structure of the eye. In diabetic retinopathy, high blood glucose causes these fragile vessels to grow where they are not needed. They tend to swell and burst, leaking blood and other fluid beneath the retina. This process causes inflammation and eventually scarring. The older you are and the longer you have had diabetes, the more likely you to be develop diabetic retinopathy. Then dry eye. The human eye needs to adequate surface hydration in order to function properly. 5% to 30% of Indian people over age 50 have dry eye. The condition occurs when tears evaporate too quickly, the eye doesn't produce enough tear film, the tear fluid has an abnormal pH composition, the eyelid doesn't close properly, or the person is unable to blink normally. Then watery eye. Watery eyes can have any of several causes. A common culprit is the weakening infrastructure of muscles and tendons that support your eyelid. Your eyelids may no longer be able to sweep tear film efficiency through the corner of your eyes, where it drains through tiny tear ducts called puncta. Alternatively, sometimes a blockage within the invisible drainage system of ducts and canals cause tears to pool in the eyes. Next, presbyopia. The odd sounding term presbyopia comes from a Greek word that literally means an old man. It refers to the farsightedness that develop as the lens of the eye and its surrounding muscles lose elasticity. This taut muscles fiber become too rigid to contract or relax properly in order to change the shape of the lens. As a result, they can no longer focus light well enough to produce crisp visual image. Presbyopia is the different from normal farsightedness, which is caused by a deterioration in the shape of the eyeball. Age-related farsightedness sets it at about 34 to 40 years of age. You may begin to have trouble reading your material, prescription, tab labels, baseball stats, receipts, and anything else printed in a small time. Presbyopia also make it difficult to perform that require sharp near vision, such as wood carving, sewing, or even painting your fingernails and applying makeup. This condition is easily corrected with reading glasses, bi or trifocal glasses, contact lenses, or you can use progressive lenses to correct your presbyopia. Ptosis and blepharitis. Ptosis comes from a Greek word meaning to fall. An apt description of the droopy, hooded eyelids, characteristics of the condition. If this draping effect is extreme enough to obscure vision, surgery may be in order. A condition called blepharitis causes redness, swelling, and sometimes crusting at the margin of your eyelids. This condition is caused by bacterial overgrowth in the wall gland near the eyelashes and usually poses to treat to the eyes themselves. So, reducing your risk of age-related eye disease. You can't control the passage of time, but you can do a great deal to preserve your sight as you age. So first, be aware your risk factor. You need to know what genetic factors, lifestyle choice, diseases and exposure place you in a higher risk category for certain disease, so that you and your vision care provider can adjust your screening interval accordingly. For recommended screening guideline, have a baseline eye exam at the age 40 if you are an adult with no risk factor for cataract, glaucoma, AMD or diabetic retinopathy. People who have no vision problem or obvious risk factors should have baseline eye examination at the age 40 to establish a standard against which future exam results can be compared. Get screened earlier or more frequent screening if you have risk factor of cataract, glaucoma, AMD, diabetic retinopathy. If you have diabetes, high blood pressure, a family history of eye disease, for example, or if you fall into high risk ethnic group, you should receive the eye examination more often. Cooperate with your vision care provider. This advice applies to examine preventive measures, treatment and follow-up care. If you have diabetes, for example, you should have a comprehensive dilated eye examination annually. If you have glaucoma, you should use your eye drops daily as prescribed. If you have AMD and your provider has asked you to test your vision with an amsler kit, you should do that every day. After cataract surgery, you should wear your eye shield and use your antibiotics as you provided has instructed. Listen to your body and report any new symptoms promptly to your vision care provider. If you have vision changes, especially if you have AMD and diabetic retinopathy, tell your provider or eye care specialist immediately. So friends, this is all about aging and eye, and the all symptoms that AMD, age-related macular degeneration, diabetes, everything is in my channel. If you like, you can go to my channel and you can find briefly about these diseases, glaucoma, diabetic retinopathy, etc. So friends, please stay safe, stay healthy. Bye.